Hello, good afternoon, and welcome. I'm Jennie Romich from the University of Washington School of Social Work and co-chair of the Social Work Grand Challenge on Reducing Extreme Economic Inequality. I am thrilled to welcome you all from around the country to today's webinar on housing inequities, COVID-19, and social welfare policy responses. Before we begin, I would like to fully acknowledge that we are slight amateurs on the webinar front here. As we are learning all of this, we ask for your patience and grace in tolerating our use of the technology. If you have technical questions, the host will be monitoring the chat function. If you have substantive questions about the presentations as they're going on, there's a Q&A function for that. So with those matters out of the way, I'd like to thank you all for attending today. I'm talking to you from my living room for the obvious public health reasons. I should also note that I work and live on the traditional lands of the Duwamish and Coast Salish people. And live among and with them today. So I'm going to introduce our panelists shortly, but I also wanted to direct your attention and give some thanks to some of the other faces on here who made today's webinar possible. Thank you to Kira Silk, Director of the Grand Challenges for Social Work, which is based at the University of Maryland School of Social Work and its remote locations. And thank you also to Dominique Crump, MSW, who's a recent graduate of the University of Michigan School of Social Work, who works with our Grand Challenge on economic inequality. I would also like to give a special welcome today to students who are attending today's seminar as part of the University of Washington West Coast Poverty Seminar. Today's webinar, however, is sponsored by the Grand Challenge on Reducing Extreme Economic Inequality, along with the Social Work Grand Challenge on ending homelessness. The Grand Challenges for Social Work program is sponsored by the American Academy of Social Work and Social Welfare, and it aims to coalesce our field's effort around 12 big picture questions, serious and cross-cutting issues that are facing the world, and to coalesce our actions so that researchers and practitioners can work together to tackle these tough problems. And in the US today, one of these persistent and challenging problems is extreme economic inequality. As my economic inequality grand challenge was thinking about different responses to COVID and the different policy responses, we started thinking about the role that housing plays, the role of income in securing housing, and also the role that housing plays in maintaining wealth for people. Most Americans' largest source of wealth is the equity in their home. But we also have extreme inequalities and economic inequalities in our society that show up in a range of housing circumstances, from people with great housing equity and great wealth to people who are unhoused and living without houses. So our panelists today will take on the range of housing policy issues that could come up as we in our society kind of collectively think about how COVID-19 is affecting us and how we will go forward. We have 3 speakers today. They are all MSW PhDs, reflecting our field's dual commitment to service and research. Dr. Ben Henwood. Hi, Ben. is an associate professor at the Suzanne Dworak Peck School of Social Work at the University of Southern California. Ben also co-directs one of the other social work grand challenges on ending homelessness, and so they're co-sponsoring this with us today. Next, we have Dr. Maria Rodriguez. Hi, Maria, who is an assistant professor at the SUNY University of Buffalo and a faculty associate at the Berkman Klein Center for Internet and Society at Harvard University. Maria's work explores the intersection of demographic change, housing policy, and social media. And finally, we have Dr. Andrew Aurand, who is the Vice President for Research at the National Low-Income Housing Coalition. They are a membership organization dedicated to achieving socially just public policy that ensures people with the lowest incomes in the United States have affordable and decent homes. Ben, I'll let you take the first presentation here. So unmute yourself, and as you need to advance slides, let me know.
Okay, great. Thanks for the introduction, and good afternoon or good morning for some of us. As was mentioned, I'm an associate professor at the School of Social Work at USC. I'm also co-lead of the Grand Challenge to End Homelessness, along with Deborah Paget, who's at NYU. And we've been working on these grand challenges since 2015, maybe 2016. They weren't really intended to be top down or kind of centralized. It really was, anyone who's doing this work can participate in the grand challenges and, to some extent, call their own. And we've tried to highlight some, some efforts on our website, which is listed there at grandchallenge2endhomelessness.org. The main thing we were working on before the kind of COVID pandemic was actually a set of policy proposals that was intended to elevate the issue of homelessness during the 2020 presidential election. And we were able to get those policy proposals that were written by experts across the country into, some members of Congress, as well as Stacey Abrams. We actually were able to hand that to her at SWIR, which was, but all that work kind of got put on hold when the pandemic hit. And so I think, like many things. So actually today's topic, we're going to talk about, COVID and homelessness specifically. So if you could go to the next slide. So people experiencing homelessness, we know, are at high risk given, they have a high incidence of ongoing health conditions, including respiratory disease. And they also have, pretty limited control over their, ability to maintain social distance at times, also for, hand washing and other hygiene-related behaviors. And we've seen, evidence of outbreaks in homeless shelters. There have been some papers already out there in Boston and San Francisco and in the New York area a bit, but in Seattle as well. And actually, if you could click a little bit too, we also know that, there's this kind of growing consensus that we shouldn't be doing symptom-based testing. We really should be working towards universal testing because people can be asymptomatic, and that kind of testing really is just not available in the homeless service sector right now, by and large. And so that's a problem moving forward. And then, you have the unsheltered population. And I think, for sure, there is a higher risk given increased comorbidities, but also, there's a sense of as long as they, could be a protective factor if they're not interacting with the general population and bringing the COVID disease to their point. But really, there, in some ways, I'll just say there's kind of no excuse for the approach. This is a picture you can see in Las Vegas of in order to reduce risk, really just getting people out of shelters and marking off sort of parking spaces outdoors that people could actually have, some social distancing there. Okay, if you can move forward, that'd be great. Okay, so the most comprehensive work to date on this issue has been done by some colleagues here at the University of Pennsylvania and at schools of social work, including at BU. And what our colleagues did was they were trying to estimate sort of the risk and the need for additional both quarantine capacity and housing capacity. And they were looking at the increased risk that the homeless population faces across the age groups. And you can look there. Panel A is the sort of the expected hospitalization rate, and panel B is critical care. They also have information on mortality. And that's really, assuming that the homeless population is at increased risk. And in particular, they're trying to look at where is the need for increased capacity. And if you can look at the map there, you see a lot of the focus on the West Coast, and that's just because of the higher concentrations of the unsheltered population. And one of the things they did was just try to estimate how much it would cost to build that increased capacity. And I had to look at the number zeros a few times to make sure I had this right. But right, it's 11 billion that was estimated, and fortunately, 4 billion of that has already been included in the what Congress has passed to date, but still much more is needed. Okay, if you could go to the next slide, that'd be great. So, one of the things I want to talk about is whether or not, COVID is what we call this housing sensitive condition. That comes from the National Academy of Sciences that sort of looked at permanent supportive housing and whether it has an impact on health conditions. And if you could just click ahead there, you'll see that, I think the assumption is that it is. And so that's why we're seeing kind of this massive effort to get people off the streets and into housing. And I was going to just focus a little bit on the work that's happening locally that I'm involved with Project Roomkey, where we have about 40,000, over 40,000 people that are currently on the streets of LA. And the goal is really to try to get, we have a lot of empty hotel rooms, and to move people into those hotel rooms, up to 15,000 people. And now what they're planning for is, okay, once we do that, where do people go? And the goal is to, in fact, get them into permanent supportive housing, what they're calling plans for day 91. So that's the goal. Currently, the last I checked, we were only about 2,000 people had been moved in through Project Roomkey into those temporary placements in hotel rooms. So you could go ahead and move forward here. One of the questions is, will this effort actually have the impact we're hoping in reducing risk for COVID? And during the third week of the pandemic, sometime in March, I was actually able to conduct a survey of over 500 people in permanent supportive housing, just to try to get a sense of both knowledge, their perceived risk, their pre-existing risk factors, whether or not they're able and are washing hands, social distancing, wearing. We weren't asking about wearing a mask at that point. That would be important now. Whether they were symptomatic at all, and whether they could shelter in place, because that was the week that in California the order first came out. Okay, if you could move to the next slide, I'll just talk about what we found. So our results there were that, I think out of the 532, only about 6 people were not aware of COVID. The majority of people were both social distancing and hand washing, 73 out of 4 people. You had 65% considered COVID to be a serious health threat, and that was actually a strong predictor of whether they were consistently washing hands and social distancing. We did have some people that were in SRO units that had shared bathroom facilities, and not surprisingly, they had lower odds of social distancing. That the homeless service system is trying to figure out right now. We saw that tenants with mental health diagnoses were less likely to be consistently washing their hands. But one of the biggest kind of takeaways, I think, from a programmatic side was that lack of sort of access to food and to soap and hygiene products and needed medications were actually identified as barriers to people being able to shelter in place. Okay, so if you could move to the next slide. You know, in some ways, what I wanted to end with was kind of how the pandemic is impacting the work we're doing, and so you know, we have several projects that are ongoing right now, but there are questions about. So, for instance, we participate in the county with the homeless count, whether we're even going to be able to collect the data that we normally do. Can we do face-to-face surveys this year? So we're already trying to plan for that. There has been work we've been doing trying to do a fall prevention pilot where we'd have home visitations with nursing and OT and social work. That got put on hold, but we're now trying to figure out a safe way to move that work forward. We had been following a cohort of homeless vets in LA to try to understand why it was that they were still on the streets given the resources available. That's kind of turned into, you know, how that group handles the pandemic. So it's really changed. We were able to do remote data collection through cell phones, so it's changed the focus of that. But more specifically, kind of getting back to these needs and the Project Room Key, what our school social work, we have a telehealth clinic, and one of the biggest challenges to Project Room Key was not so much access to the rooms themselves, the hotel rooms. There are 80,000 empty hotel rooms, but it was the support services in place. And so starting actually next week, we'll be training students to be part of our telehealth clinic so that they can provide those remote support services to people who are coming in off the streets, and hopefully transition you know, from the hotel rooms into permanent supportive housing. So I kind of want to highlight those as you know, what we're working on, really focused specifically on how the pandemic has impacted both homelessness, but also our specific work. And I think I'll just leave it at there for now.
Great. Thank you, Ben. And thank you. It was nice to see more attendees joining us since we started this. As a reminder to attendees, you're welcome at any time to ask questions using the Q&A function. We'll have a question and answer period, a bit of a discussion period at the end. But for right now, I'm happy to hand it over to our next panelist, Dr. Maria Rodriguez.
Thank you all. Good morning and good afternoon if you're on the East Coast, which I am. I come to you from my office. And I should also mention that I live and work on the lands of the Nanticoke, the Lenni Lenape, and the Powhatan Lenape nations. So what I'm going to do, oh, if you can go to the next slide, please. There you go. So what I'm going to share with you today is, first I'm going to go over some of the actual sort of disease context, thinking about COVID-19. The demographer in me always starts with infection rates and mortality. And then we'll talk a little bit about the impacts on rental housing, and we'll spend the bulk of our time talking about home ownerships. I know my colleague Andrew will be talking in depth about rental housing later on. And then I'll talk about some of the things, some of the policy interventions that have taken place. I'll focus mostly on the CARES Act and talking about interventions the CARES Act has provided for homeowners and renters, and what some of those gaps might be from those interventions. So if you can go to the next slide. So these are the sort of an accumulation of data from the census and the New York Times that folks have visualized the sort of mortality rate, the death rate per 100,000 folks. And what we can see is that urban populations, perhaps as you might expect, given constraints in spacing between individuals and between place, are the most impacted. Importantly, large metro areas located in urban counties, that rate would be lower, 2.16, if we were to exclude New York City. This is not to be confused with the infection rate. The infection rate currently from the CDC is about 10.2% of the United States has tested positive as defined through laboratory results. So we know that the actual, so that's the current rate, but we know that probably the actual rate is significantly more than that, maybe more around 20%. And what's important about this slide, in addition to highlighting the death rate in urban areas and the sort of linear decrease as we go into less dense areas, is that there is one particular caveat, actually two, when we think about death rates and infection rates in rural areas. The first is rural areas that are designated as sort of rural recreation counties. So you may have heard in the news about spaces in upstate New York and in California and Idaho, where folks have gone to sort of flee the city and have brought the virus with them and dramatically increased the infection rate in those areas. But the other caveat is, well, we'll talk about that in just one more slide. So if you can go to the next slide. There we go. So when we're thinking about rural, urban areas that have been dramatically impacted, you'll note on this slide that the top 5 areas are areas with significant populations of communities of color and that intersect with communities that are marginalized in other ways, more specifically economically. Right, so we have Albany, Georgia, New Orleans, which we know has had a very, very tough time dealing with the COVID-19. Of course, Newark, and Jersey City. If you look further down, the Poughkeepsie, Newburgh, Middletown area is particularly interesting, given it's sort of a second ring suburban area where folks who live and who work in New York City tend to live. And that one hits closer to home. My mom lives in Newburgh and she actually contracted COVID. She's perfectly fine now, thank goodness. But that is also an area with an increasing population of communities of color who are escaping sort of the price increases in New York City. So yeah, we can go to the next slide, thank you. The other caveat to thinking about rural impact of COVID-19 also has to do with communities of color. And in this case, we're talking about First People. So specifically after New York and New Jersey, First Nations are significantly impacted. You may have recently heard about the Navajo Nation, where 36.7% of all positive COVID-19 cases in New Mexico are specifically in the Navajo Nation. The graphics on the left-hand side kind of give you a breakdown. The top bar chart gives you a breakdown by race and ethnicity in New Mexico specifically. And the bottom map is actually from the Indian Health Service, and it's divided into their specific catchment areas, which don't really make a whole lot of sense. But the important part is that red area right in the center there, to the center left, is the Navajo Nation. And that represents between 900 and 4,200 cases as of last week of positive COVID-19 cases. So the Navajo Nation, 36.7% of all positive cases in New Mexico, but only comprise about just under 11% of the New Mexico population. And then when we think about the Oneida Nation, up to 25% of the positive COVID-19 cases across Wisconsin, Minnesota, and Michigan are within the Oneida Nation. So what we're seeing is that infection rates and death rates are very emphatically tied to marginalized communities, people of color, African Americans, Latinos, and First People, as well as others. And so the question sort of becomes, well, how are these folks going to be able to deal with the number one necessity during this pandemic, which is a place to live, a place to stay, to kind of ride out the storm. So if we can go to the next slide. The next graphic is the eviction lab at Princeton sort of came up with a scorecard, which I think is very interesting from a policy perspective, because they sort of pulled together how states addressed 5 key indicators regarding rental housing. And so the darker the color, the more those states enacted policies to address these issues. So eviction, obviously, whether a landlord can serve a tenant with eviction notice, whether states have ceased that, a court process, whether the state has suspended eviction hearings overall, enforcement of eviction, whether a state has barred law enforcement from actually executing an eviction order. Short-term supports are interesting, whether a state has extended eviction moratoriums or any emergency protections, particularly past the state of emergency as it has been defined by the federal government or by the state. And then lastly, tenancy preservation. So trying to think about whether states have barred any late fees, whether they've extended tenant legal representation in court, and so on. Interestingly, the best state, according to this particular formulation, is Massachusetts with a 4.15 score. The worst is actually a 5-way tie between Arkansas, Idaho, Missouri, North Dakota, South Dakota, and Wyoming. That was actually 6. Sorry about that. So I think that this is particularly telling when we think about how people will be able to handle whether or not people will be able to keep their homes that they are currently renting, both during and after this pandemic. If we go to the next slide, I think the National Multifamily Housing Coalition put together this graphic and has been keeping track since the pandemic began in terms of actual rent payments. This survey represents about 11.5 million rental units, but they're privately managed properties. To put that in context, about 48.5 million, there are about 48.5 million total rental units in the United States estimated. So what we can see is that over time, compared to last year, we have about a 10% increase in late rental payments. And we can imagine that as we get closer to the end of federal and state guidelines for the ends of states of emergency, we might see that rise by another 5 to 10% estimated. We can move to the next slide, please. So the CARES Act provides some guidelines for rental housing, but I'm going to focus here more on the guidelines they focus on for mortgage relief. So really it provides for 2 specific options. Either homeowners with mortgages can request a forbearance from their lender, there's a 60-day sort of moratorium on foreclosures. What's important about the CARES Act forbearance option is that it only applies to federally backed mortgages. So there's about 7% of federally backed mortgages that are currently in forbearance right now. They can remain in that forbearance for 180 days with the option to increase their forbearance by another 180 days afterwards. And I did some digging around privately securitized and portfolio held mortgages, and that it sounds like about 6.7% of those mortgages are currently in forbearance. And so this totals to about somewhere between 7 to 13 million people overall. And what's interesting about forbearance, of course, and if any of us have any student loans, you might know that forbearance doesn't mean that interest stops accruing, and it doesn't mean that you don't ever pay it back, right? It just means that you kind of kick the can down the road. And the CARES Act kind of gives you 3 different options. You could either pay the amount that was deferred through forbearance. You can pay that in one lump sum at the end of the forbearance period immediately following. You can add that to your existing monthly payments over a set number of months, or you can add it to the end of your loan as an additional payment or as a lump sum, which is interesting because it assumes that you'll have the money to do that. If we can go to the next slide. So what's interesting is that as I mentioned, the CARES Act only specifically applies to mortgages that are federally backed. Many states and localities have adopted some of the same policies or mimic them. So for example, in New York State, you can, any state-backed mortgages, you can request a forbearance for 90 days with an additional 90 days being available to you following. But of course, the question is, who's going to pay? So there's some policy proposals. There's a social media campaign that has made the news recently called Cancel Rent, and within Cancel Rent is also Cancel Mortgages, where the proposition is that all rent, mortgages, and utilities that took place during COVID-19, so specifically between March 15th and May 15th, plus 90 days after the reopening, should be completely disavowed and never owed. That movement has quite a few nonprofit organizations, social action organizations behind it, as well as some movement within certain state legislatures, or at least conversations, I should say. The other policy proposal that I've heard of recently is universal housing vouchers as a way, as an intervention for all people residing in the US. So that would mean a certain amount of funds would be sent to landlords. Oh, I'm sorry, that's rent relief. So the Cancel Rent, what's interesting about that, in addition, is that campaign also calls for blocking of corporations from purchasing large swaths of land or properties that become available as a result of the pandemic. The rent relief is a policy response that I've also seen, which is a certain amount of funds are sent to landlords on behalf of the tenants. Those are very limited. I've seen that around $400 to $500 to allow tenants the ability to sort of hold off from being late on their rent until they receive their stimulus from the CARES Act. But of course, none of these current proposals actually deals with the biggest question, which if you hit the button, Jenny, would be who's going to actually pay all of this money? So if you look at some of the estimates, we're talking about billions of dollars, either in mortgages and lost interest, as well as in property and so forth. And so as people are being impacted by high infection and death rates, as those infection and death rates are particularly centralized in already marginalized communities, we can see that there's a very clear need moving forward for some strategic proposals. Thank you.
Okay, thank you, Maria. And it's nice to see a little bit of the Q&A going on, including at least one person who seems to be here on the basis of being a Maria Rodriguez fan. I did want to say a shout out to Patrick McLaughlin, who's joining us from Eastern Washington University, and just sent a nice note to the Q&A about being able to think through these issues together with folks who spend a lot of time thinking about them. So thank you for being here, Patrick. Thank you for everyone else who's on here. And I'm pleased to hand it over now to our final speaker, Andrew Aurand. And again, encourage everyone to send questions. We'll have some time for a full panel discussion after Andrew's talk. All right, thank you, Andrew.
Thanks, Jenny. So I'm Vice President for Research at the National Low Income Housing Coalition. And as Jenny said earlier, we're a national policy research and advocacy organization that has about 1,000 members, but many of our members are other organizations. So we have a subscription list of about 140,000 people that receive our calls to action when we want people to contact Congress, or our memos send out to members about what is going on related to housing policy, and our other materials. And we focus on federal policy to ensure that the lowest income households have adequate and affordable housing. And we focus on extremely low income renters because it is the rental market that predominantly serves our lowest income individuals and families in the country. And so on the next slide, you'll see, if you look at the left-hand side of the next slide of this slide, you'll see that there's about 9.4 million cost-burdened, extremely low-income renters, and those are renters who spend more than 30% of their income. The orange bar, nearly 7.8 million of those extremely low-income renters spend more than half of their income on rent. They're severely cost-burdened, and so they have very little for other necessary expenses like food, clothing, and transportation. And just to put this around some context and incomes.
Andrew, we've had a request that you speak a little more loud.
Sure. You know what? I had this issue before. I'm also going to turn up my volume a little bit. I had this problem the other day too.
Okay.
Okay. So if you can't hear me in another 30 seconds, let me know, and I'll speak louder too. So there's about 7.8 million extremely low-income renters who are severely cost-burdened, meaning they spend more than half of their income on rent. And just to give some context to this, when I say extremely low-income renter, they are families who earn less than the poverty level in most places. And so for a family of four, that would be less than $25,000 a year. And they account for about 3/4 of all severely cost-burdened renters in the country. And if we think about extremely low income and very low income renters, and those are renters with incomes up to about half of the area median income, those two income groups account for about 90% of all severely cost-burdened renters in the country. So they are the ones facing by far the biggest challenges when it comes to housing affordability. And I'm just going to mention that this was before the coronavirus, and it has gotten definitely worse since then, and I'll talk about that in a minute. And on the next slide, the other thing I want to point out is there's very clear racial disparities with regard to who is an extremely low-income renter. So the pie chart on the left-hand side is all households in the US, and about 65% of all households in the US are white, about 12% are Hispanic, and 12% are Black. If you go over to the pie chart on the right, those are extremely low-income renter households, and only 43% of extremely low-income renters are white, and about 47% of extremely low-income renters are either Hispanic or Black. And here is something that we point out in one of our reports called The Gap, which is about 1 in 5 Black households are extremely low-income renters, about 1 in 7 Hispanic households are extremely low-income renters, and about 1 in 17 white households are extremely low-income renters. So there's clear racial disparities when we talk about affordable housing and housing affordability and who our programs target. The other thing I don't have a slide for, but I'm going to briefly mention, is that when we talk about extremely low-income renters, about 7% of those households are in the labor force, and another 46% are either seniors or they're people with disabilities. So more than 80% of these renters are either people with disabilities, or they're seniors, or they're of working age in the labor force. And about 4.5 million of them are in the labor force. And the next slide shows where these households are working. And more than half of them work in these 3 top industries that are listed on this graph, which are accommodation and food services, social assistance and healthcare, and retail. And in this case, when we say healthcare and social assistance, we're talking about people like childcare workers, home health aides, those types of occupations. And on the next slide, you'll see how the industries that have accounted for the greatest job loss in the past month. So according to the Bureau of Labor Statistics, their most recent unemployment report came out last Friday, and 3 industries accounted for half of job losses in the past month, and they are accommodation and food services, retail, trade, and healthcare, and social assistance. So clearly, extremely low-income renters are in the labor force are being severely impacted by not just the public health crisis, but also the now economic crisis. And if we go to the next slide. Yeah, I just want to mention quickly that, you know, the first act that was passed by Congress, it was towards the end of March, was the CARES Act, and our other speakers have mentioned the CARES Act as well. And there were some important things in here for renters. And one was a moratorium on evictions of tenants, but it only applies to properties that are federally supported, either with federal subsidies or a federally supported mortgage, meaning it is somehow related to the FHA, Fannie Mae, or Freddie Mac. And I'm going to come back to that point in a minute. The other thing it included was some very important financial support for some of our housing programs to serve extremely low-income renters and people who are experiencing homelessness or near homelessness. And other speakers mentioned some of this. I won't get too much into it, but there was some money for the emergency solutions grants for people experiencing or at risk of homelessness. There was $5 billion in CDBG, Community Development Block Grant funds, to go to cities and states that they can use in a variety of ways, either for public services, social services, or also for rental assistance, short-term emergency rental assistance. Then there was another $150 billion for states and local and tribal governments to deal with expenditures related to public health crisis. That could include housing assistance for eligible households in danger of losing their home or housing instability. So it could include short-term emergency rental assistance, but it has clearly not been enough. And I just want to briefly talk on the next page, one of the problems, or next slide, one of the problems we ran into with the CARES Act. Very important to have a federal moratorium on evictions, but it was a limited moratorium only on properties being supported in some way by the federal government. The problem is that most tenants do not know if they live in a property that would be covered by the moratorium. I mean, imagine, if you ask a tenant what kind of mortgage their landlord has, how would they know? And you cannot easily find that information. So we developed a database of just multifamily properties. So they would be apartment buildings with more than 5 units or apartment complexes that we could use data from FHA, Fannie Mae, Freddie Mac, and all of the federal affordable housing programs. And we created a database that renters could go to and look up and see if their property was covered. It is not comprehensive because it does not include small rental properties of less than 5 units or single family homes. And we know they account for about half of the rental market. And we're working very hard to try to get FHFA, Fannie Mae, and Freddie Mac to provide that information on single family homes and small rental properties. This has received a lot of attention, and just in the last day or two, media has also starting in some part through our help and through us putting this database out there. They have combined this database with information that another speaker talked about the evictions lab. So ProPublica now has a website with our database plus some of their own data plus eviction lab data. Patriot Act, the show on Netflix, has just done the same thing to try and get this information out there to renters just as broadly as possible, because it is so difficult for renters to know if they're covered at the federal level. And of course, there's all these local and state moratoriums that are very important that need to be in place, but there's so many of them, it's hard to keep track. And so there are organizations trying to do that. And if we go to the next slide, I just want to talk a little bit about the other thing we did is we recently estimated how much we needed in terms of rental assistance to help extremely low and very low income renters. Well, in this case, in this analysis, we included all low income renters. And so they would be renters who earn up to about 80% of their area median income. And a Pew survey recently found that in the past month, about 52% of low-income households reported either losing income or losing their job as a result of the coronavirus and recent employment declines in employment. And other surveys have confirmed this, both by the Urban Institute and now by the Federal Reserve. They have found similarly high numbers. And so based on that, we estimated that there's probably about 12.7 million low-income renters whose employment has been affected by this crisis. Using average voucher costs, Housing Choice Voucher Program, which is our federal rental assistance program, using the average cost in each state to assist these 12.7 million renters would cost about $9.9 billion a month. And we assume that would be through the second and third quarters of 2020. The other thing we did is we tried to think about, well, what will happen in the future or in the coming months, a few quarters from now. And
Andrew, you cut out for a minute there.
oh, I'm sorry.
Last I heard was in the future, a few months from now.
Oh yeah. Okay. So right now we figure cost would be about $9.9 billion a month over this quarter and the third quarter. The CBO projects that we are going to have a slow economic recovery. In fact, in projections they just released in a short article, estimate that at the end of next year, so at the end of 2021, we would probably need, unemployment would probably still be about 9.5%, which is only slightly lower than peak unemployment of the last recession. And so we thought about, well, what would we need in rental assistance in those coming quarters up until next June if unemployment got better that slowly. And we come up with about $116 billion over the next year up until the end of next June. And then if we can go to the next slide. So some of the things that we feel are very important, and actually we're very thankful to see are in the new HEROES Act, is that rather than have this sort of patchwork of local and state and federal eviction moratoriums, there really should be a national uniform universal moratorium on evictions and foreclosures, at least for the time being. We also need emergency rental assistance and eviction protection. And as I said, we estimated to be about $116 billion for a year. More aid to the Emergency Solutions Grant for people experiencing homelessness or at risk of homelessness, and then also additional funding for housing stability. And what we mean by that is at some point we need to be thinking about the longer term. And the recent HEROES Act does include some money for rental assistance vouchers that would be temporary, but they would go through our voucher program that currently exists. They would just sunset after a household quits using it. They would not be renewed. Then additional funding for public housing authorities so they could afford their extra costs that they're now experiencing because they now need provide greater subsidy to extremely low and very low income recipients who have lost their income. And so that as well. And I'll just leave it at that. I'm happy to answer questions. Sorry for the slight sound problems.
All right. Well, thank you for being with us, Andrew. And I have a few more notes here of things that have come in on chat and on the Q&A. We are about to start discussions. So for those of you in the audience, if you have questions, please put them into the Q&A. I understand we have someone joining us from Romania. Kira let me know that and that it is 11 p.m. there. So thank you for whoever is joining us from Romania. And then in the Q&A, Bethany noted that the website set up by Patriot Act is don'tgetkickedout.com. And so that's the one that uses the data from Andrew's organization aggregated with some other organization to help provide a resource to tenants for figuring out how to retain their housing over this time period. All right, let me advance my own slides here. So thank you first to all three of our presenters. Were this live, we would be clapping, but that's not going to be good audio on our remote things. I will lead off with the chair's prerogative here to start with one question. To some extent, all three of you talked about some of the racial and ethnic disparities that show up in housing and homelessness and that stem from and mirror America's persistent racial inequalities. What can we be thinking about as federal policy goes forward and trickles down to states and localities in terms of making sure our response does not further create racial disparities, or what can we be doing to think about creating racial equity going forward? And I'm just reminding, I saw Ben unmuted himself. If our speakers maybe could all unmute themselves, and I'll tell you again to mute if that causes problems. So
yeah, well, I'm happy to begin the responding, just because we know, especially in homelessness, how it disproportionately impacts African Americans and in this country, and and locally here, African Americans and Blacks make up only about 8% of our county population, but over a third of our homeless population. And I think, putting aside the current pandemic, I mean, one initial question is just whether our homeless service system itself perpetuates any discrimination, and so whether we see, proportional placements. And there's been some work done in LA County that actually looks at housing retention, and it seems to be lower among African Americans. So I think one of the first places is just make sure that the system's not making it worse. And then I think a question is whether, especially because homeless services is kind of a catch-all, whether it should work as some corrective function for all the structural elements that came before that sort of led to that inequality to begin with.
I think, one of the points that I would make is that we need to be cautious about. So historically, I mean, this disaster, the coronavirus disaster, is a little bit different from disasters in terms of hurricanes or tornadoes, because housing is not big, but it is a disaster, right? Nonetheless, and we have a history of providing more aid to homeowners than we do to renters, and there are clear racial differences in the impact of that. And so I think we need to be mindful of that renters, particularly those who are on the edge of losing their housing, who were struggling to pay their rent even before this economic crisis, they're even struggling more now. They are, disproportionately people of color. And we just need to be very much aware that we need to pay as much attention to how we respond on the rental housing side as we do on the home ownership side. And we unfortunately, historically, have not really done a great job at that when it comes to disaster response and disaster recovery. I think, though, what's promising, though, is there is a lot of attention this time about the hardships of renters, and that is very good. I mean, that's very promising that so much attention is being focused on that today.
Yeah, I would say that I think I saw a question in the chat about, well, do we have to depend so heavily on market forces for housing? And I think, well, until somebody dismantles capitalism, which, I don't know, if you're doing that, great, thanks. But, in the meantime, this is what we have to work with. And so there's always the tension between, do you work within the system or outside of it, right? But in as far as working within it is an option, I think that one of the things that we might look at, and particularly speaking to what Andrew's mentioning in terms of the social construction of renters versus the social construction of homeowners, is thinking about different models of home ownership, right? And so one option that I've always been very enthusiastic about has been community land trusts. So ways that we can sort of somehow flatten the ownership of the land and therefore sort of keep market prices affordable and allowing for not just people who want to be homeowners, but maybe people who want to be renters as well, right? And working within those structures. I know there's not everything about community land trusts is great. There's different research out there. There's some good things. There's some, maybe things that we're still working on. But in terms of moving forward, I think different structures of home ownership, potentially thinking about housing as a right and not a commodity. But that's getting towards dismantling capitalism again.
Well, so I did want to call out that question more generally about depending so heavily on market forces for housing. And I always tell my students it's not about market versus non-market, it's about the set of rules within the market or the set of rules within the distribution system. And I think Maria's example of thinking about community land trusts as a different set of rules is a good one. But I also think some of the work that Andrew's organization is doing on just and that Maria and Ben have discussed in terms of what is in the federal response acts, kind of who are funds going to and under what conditions. So those are all kind of the rules within the structures of our response. Let's see, other questions that are coming up here. One question was around just the relationship between income inequality and the conditions we're seeing here. Oops, I moved too far ahead here. One of the things that happened during the Great Recession, and I know Maria knows this because it was in part the subject of her dissertation work, was that the responses, the policy responses and the way the market worked served to create wider wealth disparities after the recession than there were before. And so I'm just curious about ways in which you see the current policy options as being able to mitigate income and wealth inequality or potentially exacerbate them.
Andrew, you look like you wanna go for
it.
it.
Do I have my thinking head? I guess I look like I'm thinking, I guess. Yeah, I think, when it comes to renters and those who are at risk of being evicted, one of the problems we have is, the eviction moratoriums are really important and they're great, but they're gonna end. Mm-hmm. And there is no relief at the moment for those renters. I mean, they're still responsible for their rent. Mm-hmm. And if they're not keeping up with their rent, what they owe at the end of this is going to be even more. And that's why we need rental assistance so desperately, is because that cliff is coming and we see it coming. And we know that, the ramifications of people being evicted is, it's very detrimental to their mental health, to their physical health, to their economic health. Low wage workers who, in normal times lose their housing, their likelihood of losing their job also goes up because it starts this spiral of all these different things they have to start taking care of to find housing. And it's very difficult to find housing if you've been evicted, and landlords know whether you've been evicted from another property. And so I think by not addressing it, we do make things worse for low-income renters, and it will be harder for them to recover from this if we don't do something. Where I feel like, if we do the opposite in terms of homeowners and we provide homeowners aid, keeping them in their home while they continue to build assets, meanwhile renters are just, they're just kind of left hung out to dry, so to speak. And we need to make sure that does not.
Yeah, I think building off of that, something I've been thinking a lot about, more in the other space that I inhabit, which is sort of algorithmic decision making, which is not unrelated to housing, actually, if you've ever filled out an application. But that's a different webinar. But one of the things I've been thinking a lot about is something that I think I call sort of the ethics of the margin. And sort of, it's the idea that if we were to center policy on the least and the last, that we would by definition, capture everyone else. And part of, some of that is political will. How willing are people to think about the least and the last as the cornerstone for all social policy, right? Whether or not that's a big lift. But I think that there are what I might call subversive ways to try to center the margins. And I think that would be, that's part of what we're responsible for as social workers, both as practitioners and as scholars, is finding ways to overtly and covertly center the margin.
Well, that's a nice transition to my next question here, and this came in from Laura on the chat. Apologies if I got your name pronunciation wrong there. They write, COVID-19 cases are low in my community, but finances are drastically impacted. How do I advocate with local leaders to realize the anticipated needs and to effectively plan? And I've created a survey and I've collected data on community needs and have shared. I think more broadly, what roles do you all see for social workers at the different levels of government here? I mean, a lot of the response to this disaster has been federal, but for the most part, what's being implemented, particularly on housing, is at the city or very local level, and states are another important intermediary. So what are some different levels of government that social workers should be thinking about working on now?
I think one of the things at the local level is thinking about how to spend the relief money that is becoming available and where that can best be used. So, we know that states through the Coronavirus Relief Fund are getting a significant amount of money. CDBG-CV is going to some entitlement communities. And at that level, both at the state level and the local level, I think it takes, at the federal level, we do a lot of advocacy work. That's predominantly what we do. But that money then goes to the states and to localities, and oftentimes that is flexible money. And so it takes a lot of attention and work at the local level and the state level to continue advocacy to make sure those funds are used in a way that the community thinks is most helpful. And so, for example, rental assistance, I keep coming back to that because that's so important. There are some communities that had either locally funded or state-funded rental assistance programs prior to coronavirus. Now there's a number of more municipalities that are considering rental assistance with some of their relief funds. But if communities haven't done that before, they need to learn how to do that. And so we're in the process of now starting to get information out about places that have rental assistance programs, because maybe other places that don't could learn from the places that do. Because I do think there's a component in that is just of sharing information and learning from others where programs exist, what programs could be implemented if they don't exist.
I would say very, very pragmatically, a lot of localities, local municipalities, city governments have been holding all of their meetings on Facebook Live or YouTube Live. Even I was looking at even First People nations are also holding their nation sort of meetings live. And historically, any local government, any meetings are, buried in websites, and it's incredibly difficult to find them. But now all you have to do is just follow your public, your officials, right? And you can sign up to go to these meetings very practically and voice your concerns, both as a practitioner, as a scholar, as a human, as a neighbor. And so practically, just go to your municipality meetings and advocate.
From the convenience of your own kitchen or living room.
Absolutely.
And I was just going to weigh in. I think this is it's a really challenging question, because when you think about, all the efforts, for example, just pandemic, there's so much work being done. and yet at the same time, at a different level, I don't know if people saw, but a recent study by Dan O'Flaherty from Columbia that was projecting out that the homeless population will increase by 50% given the unemployment rates. And so all the work being done sort of, again, if you think of that downstream, upstream type, prevention issue, working very hard on the one hand, but then realizing that, as cities and governments furlough and lay people off, that's actually contributing to the very problem that they're then spending money to try to solve. And so I think from my standpoint, a lot of what we can do, things are very dynamic. And I think just as much as you can get, and this was a great example today of having decisions be as data driven as you can. And at a local level, if you have information, whether that's getting surveys done or analyzing some data, I think that's going to be really important given how quickly things are changing.
Andrew, I see you're nodding. I don't know if you have anything to add.
No, I'm just agreeing.
Okay.
Yeah.
Okay. Yeah, I thought Ben's
be on a panel where I agree with everything is said,
selection there. I think Ben's last comment was interesting, and one of the other questions I'd always been thinking about this is, what should social work scholars be doing, and what should those of us who are lucky enough to work with social work students in training be doing? And this conversation I set up to feature macro social work issues, but I think it shows the importance of our profession being involved in these policy considerations, and of all social workers, whether they do direct clinical work with individuals who are being affected on a one-on-one basis, to doing policy work, having an understanding kind of the scope of the problem and how it affects people at the different levels. We've had a few other specific questions here. Ben, we did have one question from a student who wanted to know more about the USC telehealth clinic. Is that something they could email you about?
Sure, yeah.
Okay. All right.
I try to respond, but some won't let me do it directly.
Okay, all right. So I think we have just a few minutes left here, and I'm going to ask my panelists kind of a larger ranging question, and you're welcome to stay in the housing and homelessness consideration, or think more broadly about the work you're doing in a more expansive sense. But kind of what as you're thinking about policy and the institutional structures going forward, do you see as potential bright spots, or kind of what gives you hope as you're thinking about your professional work here? Just one small question to end us all. And maybe what would give you even more hope?
I'm happy to just quickly weigh in. I think what to me is so remarkable is how, the thought of getting 15,000 people off the streets and into housing in a short period of time was a bit unheard of. And then the world sort of stopped, and lo and behold, we can do it. Now I realize that there were mitigating issues, and all of a sudden hotel rooms, popped up. But you see the Army Corps of Engineers coming in and developing places for people to stay, and hospitals. There's so much we could do if we really want to, and I think that just kind of shows what it means to have political will to do these things, and what seemed unheard of is now possible. And as hard as the pandemic has been, to me that's a bright spot moving forward, and that this could really rebalance. We have the potential of rebalancing some of these things.
That's similar along the lines of, I think, what I would say. There's not been many events, actually few events in history that that have really highlighted how important housing is to healthcare and our personal well-being and to public health, which is, an argument we've made for quite a long time. I mean, and it's never been more clear, I think, to everyone than right now. At least I hope it's clear by now to everyone. And there has been that will to try to get things done. And I think that, the fact that, the new HEROES Act that the House just passed, includes a significant amount of money for housing, I think, shows that, people are recognizing that housing is so important. And I hope that in the long run that lasts. I mean, it's, there's that, hopefully, our hope in the long run is that we have more permanent type funding for programs that really help renters. So they are not at risk of housing instability when when something like this occurs. I mean, why is it that we have millions of people who are either, millions of people experiencing housing instability or having a very hard time paying their rent in one of the nations, or one of the wealthiest nations in the world. And, this is a challenge we've had now for decades. And I just hope that, this will hopefully show how important stable housing is.
Maria, last word.
Yeah, I think what gives me hope is this is probably the best time to be innovative. The ability to, those of us that have the privilege to have a safe place to live and not worry about most of our, the bottom of the pyramid of Maslow's hierarchy of needs. I think we have an opportunity and a obligation to use this time to be as innovative as we could possibly be. I think there's a lot of funding right now for COVID-19 related research. Those of us that work on housing should be, getting together in groups to apply for this funding, to try out different things. I know folks who are working on tiny homes for folks with co-occurring mental and emotional limitations. I think there's folks working on 3D printing of housing. I think that we could come up with something to try to just test things out. I think there's space now to throw things at the wall and see if they stick. That's not usually how scholarship goes, but maybe we could do that for the time being. See what happens.
Great, thank you. And Maria, I actually wrote down what you'd said earlier about centering policy on the least and the last. I think one of the most hopeful things for me about the present era is that we are creating what happens next right now together. Like there's no predetermination, and there really is room for advocacy, whether it's showing up at your virtual city council meeting or making your voice heard through organizations locally or statewide that work with national organizations. This is a real opportunity for change, and we're going to see a massive rewriting of our safety net in the short term. And insofar as social workers can help make that kind of durable and positive changes, I think there are some real opportunities here. So thank you all for attending. We did record today's session, and it will be up on the Grand Challenges for Social Work YouTube site. I saw from the names of the attendee list today that we have some people who were with us last week. But if you weren't with us last week and are interested in last week's discussion on learning from history about disaster and economic inequality, the recording from that is up on the website too. And I also wanted to give a shout out to one of the other social work grand challenges on harnessing technology for social good. Early on in this pandemic, they put some resources together for folks who are thinking about pivoting to doing teaching and running organizations online. And so that is also up on the Grand Challenges YouTube channel, as are some information about the different challenges. You can find them on Twitter, the Grand Challenges as a whole. You can find our Grand Challenge on ending extreme economic inequality there. And we urge you to stay in touch. We're happy to take suggestions about new webinars and to continue this conversation online. So for right now, I'll say one last thank you to everyone for attending, and to Dominique and for Kira to help for your assistance here. And I believe Kira will now close the meeting.